All right, Dr. Chris Labos is on the line. We've managed to connect. He is a cardiologist with a degree in epidemiology and, of course, a regular contributor here on CJAD. Dr. Labos, want to talk to you about the story yesterday. Kind of came out of the blue. The World Health Organization coming out and basically saying global health emergency over mpox. Now, I know the original issue here was particularly in parts of Africa, the Democratic Republic of Congo, one of the main areas. Why this worldwide declaration?
I think it's mainly to stimulate the international community to actually do something, because what the Africa CDC has called for is they've called for millions of doses of vaccine. And there's no way to do that unless the international community can come together and allocate the resources. So the whole reason to declare something a public health emergency of international concern is not just for the sake of labeling it as dangerous, but it's to motivate countries to work together to establish or to do something that is going to be productive to address the issue. And in this case, it's about getting vaccine doses to Africa where they are sorely needed.
So for people who don't know, what exactly is mpox and who does it affect?
So mpox is what we used to call monkeypox. It is a viral infection, very closely related to smallpox. And so what it causes is a viral illness, very similar to smallpox, actually, in terms of the skin rash that it produces, these small pustules. Most people only heard about it in the context of the 2022 outbreak that we had here in Montreal and globally. And what happened there is, even though mpox was previously happening in Africa, you know, it is sort of endemic in Africa. But the only reason we've been talking about it is that we had this spillover into the international community in 2022. And so it's becoming a problem now, not because it's the new disease per se, but because we're seeing more and more cases of it, and we're seeing more and more international cases of it. And the most recent clade, the most recent strain that is causing the increased number of cases, whereas before it was previously localized to Africa, there's actually been a single case reported in Sweden just recently. So there is a worry that this situation is going to spill over into other countries, and we might get a situation similar to what we had 2 years ago. So
with respect to, I know we checked earlier today, just here in Quebec or in Montreal anyway, with respect to cases here, I don't think there have been any. Do you know?
No, there has been an uptick in Toronto, and that's why Toronto Public Health issued not quite an alert, but sort of a reminder to people who are at high risk that they should go and get vaccinated. And that high-risk group is men who have sex with men, sex workers, people in that field. And that's not because the virus is a sexually transmitted infection, as some people have assumed. It's because the original cases in 2022 all seem to be in that community. And once you have a virus in one community, it tends to spread amongst people in that community. It's primarily spread by skin-to-skin contact. And so those are the groups who are at high risk. Those are the groups who need to be vaccinated. And while Toronto has been seeing that uptick in that community, we haven't really seen the same thing in Montreal, which, of course, is the reverse of what was happening 2 years ago when Montreal was the epicenter of cases and you had very few cases in the rest of Canada.
With respect to children, I was watching a video. Are young children particularly susceptible to this?
So anybody can be infected if you are in close contact with somebody who has the virus and who has open lesions and you come into contact with them. Children are not any more susceptible than anyone else. The only way they could get infected is if somebody in their household got infected and they were in close contact with them. So in that respect, potentially so. But they are not the high-risk group that public health is aiming for in terms of vaccination. It really is people, in the community of men who have sex with men or sex workers. So it's not children per se. They may have a more severe case in certain circumstances, potentially, maybe, but they're not the high-risk group that public health is worrying about.
All right, let me shift from that to something else. And I've been seeing more and more stories like this, and that's the fact, and I don't know if we talked about this a while ago, COVID, despite the fact we may be done with it, is not done with us. Stories that I'm seeing, case rises in different places across even North America. So people are wondering, wait a sec, the fact that it's still here, And I think to some degree, Chris, I don't know if you'd agree, we're kind of pretty lax about this right now. It's like, well, if you get COVID, you treat it like a flu, you stay home for a couple of days and that's the end of it. But the idea is we know when the weather gets colder again, it's likely to be a problem again in the fall, heading into the winter. What do you do vaccination-wise? Are we waiting for a new vaccine? What's the status right now?
Yeah, so there is going to be an updated vaccine in the fall. We don't know exactly when it's going to be rolled out, but it's expected to come out at some point in the fall. Very likely what the government is going to do, very similar to last year, is roll out the influenza and the COVID vaccines at the same time. The COVID vaccine is going to be a different vaccine. It's going to be an attempt to match it as closely as possible to the circulating strains. So, again, very similar to what we do with the flu, where it's a different flu vaccine every year. And that likely is going to be the strategy going forward, trying as much as possible to match the COVID vaccine to what's circulating and giving it every fall, because that is going to be when cases surge the most. We are seeing a bit of an uptick now, and we have often seen a bit of a summer uptick of COVID for reasons that are not completely understood. But the lion's share of cases in most of the spike that we usually see is expected to come in the late fall, early winter, when most respiratory viruses do, in fact, peak.
With respect to now, I can only imagine big crowds. You have lots of festivals. Would that be a consideration as to why it might be happening now?
Yeah, that travel is a big one. I know a lot of people who get sick
Sure.
after they travel. They get on a plane, they come back, and that's when they get sick. So there's probably a lot of factors that play into it. It's interesting with COVID because it does not obey the same rules that we see with influenza and other respiratory viruses. Influenza essentially disappears during the summer, and there isn't anything circulating, or very, very little. But COVID never really goes away, and contrary to conventional wisdom, it tends to have a peak in late summer like we're seeing now, and then it will be quiescent again for a little bit and then start to pick up steam again as we get into the later fall, as schools start, as people spend more and more time indoors.
Last question, because some people will wonder now who've had, 3, 4 vaccinations. If this is just like the flu and you have to sort of worry about a new strain every year and a new vaccine, those 3 or 4 vaccinations that you've previously had, that's not guaranteed protection of any kind, right?
No, at this point, I would say that, people say, well, I've had 3 doses, I've had 4 doses. The number of doses you've had in the past is to a certain degree irrelevant at this point, because it is essentially a different virus or a different strain or a different Omicron substrain of the virus every year, and it's going to be a different vaccine every year. So what happened last year is almost not relevant to what's happening this year. Especially if you're a high-risk individual, you should be getting the updated COVID booster every year. Some debate about whether very high-risk people should be getting it every 6 months. That's a bit of a more nuanced question, but for the most of the population, at the very least, getting it once a year, irrespective of what happened the year before.
All right. Dr. Labos, as always, really appreciate the time. Thanks so much.
My pleasure. You take care.
You too. Dr. Chris Labos, there you go. Everything you need to know. And I know a lot of people, I remember seeing a text message about this saying just what he said. I've had 3 or 4 doses, whatever. Is that enough? So the answer is no. What you had before doesn't count. Viruses mutate. There'll be a new vaccine come in the fall. And as he said, probably, and that started to happen last year, right? A lot of people were getting it. We're getting the flu vaccine at the same time. Looks like that'll be what happens again this year.